Nail health can point to poor nutrition, an autoimmune condition, or even something as serious as kidney disease. But how to decode what they're telling us? Don't worry, we got you. It's common to have vertical ridges on your nails that run from top to bottom. In fact, 20% of adults will develop vertical ridges, which are usually just a sign of aging. Hair, skin, and nails all contain the protein keratin.
She's just gonna whack off some of their hair and fingernails.
Hair and fingernails?
Just as our hair and skin get drier as we age, so do our nails, which can lead to those ridges. Horizontal ridges on the nails, ridges running side to side, are less common. These are known as Bowes lines. Often, they can be due to injury to the nail bed that stops the nail from growing, like jamming your finger in a door. But sometimes, these horizontal lines can be due to something more serious, like acute kidney disease. And if Bowes lines show up on all 20 fingernails and toenails, it could be a symptom of parathyroid disease, mumps, unmanaged diabetes, syphilis, respiratory conditions, illnesses with prolonged fevers, or zinc deficiency. They can also be a side effect of chemotherapy. So if you're unsure whether to be concerned about ridges in your nails, see a dermatologist. A traumatic injury can do significant damage to your nail, causing it to bruise and disrupting its natural growth in addition to impacting its appearance. Visible ridges can form as a result, usually in the form of Bowes lines, or even small bumps that remain even after the initial injury heals. Trauma can vary from slamming your finger in a door to stress from a repetitive activity, like frequent tapping. The matrix, which is the area beneath the cuticle that's responsible for building new nail cells, can become damaged and affect growth. Depending on the severity of the trauma, it may take several months for the nail to grow out. And in more severe cases, the trauma could affect the matrix permanently. This might lead to more lasting irregularities in nail texture or thickness. It's worth noting that trauma isn't always the result of a major event or accident. Even something as simple as wearing ill-fitting footwear or chronically picking at your nails could be enough to cause subtle yet lasting damage. The good news is that time and patience can usually improve things. Trimming nails and protecting them from further injury can encourage healthier growth. Onychorrhexis is a nail disorder that causes ridges, which typically have a striped appearance. Because the nails may grow more brittle with onychorrhexis, it can cause them to soften, split, and break. While the condition isn't dangerous, it can be a sign of other health issues. For example, people with rheumatoid arthritis, thyroid disorders, and heart disease may be more prone to developing onychorrhexis. Sometimes, though, the culprit is simply aging. Nails can lose their integrity as we age, leaving them dull and less resilient. Interestingly, this condition doesn't necessarily affect all of your nails. In some cases, it may affect just one. It's not always easy to determine the cause, which is why it's important to see a medical provider, especially if this is a new symptom or appears to be getting worse. Treatment depends on the underlying cause. If it's a nutrient deficiency, you may simply need to add a supplement to your routine. If it's age-related, adding nail care to your self-care regimen can be helpful. Moisturizing, avoiding biting, and drinking enough water while consuming healthy foods can help support nail health and potentially prevent onychorrhexis from worsening. Psoriasis is an autoimmune condition that can cause inflammation to run rampant in the body. Because skin cell production is essentially in overdrive, raised patches can develop. They may be red, scaly, and itchy, and be very difficult to control. There are different types of psoriasis, though, and in some cases, the nails may be affected. They may appear irregular with small dents or ridges that almost resemble small pits. They can also develop Bowes lines as the condition progresses.
I want you to know that it doesn't bother me at all. It doesn't bother me at all that you have it, and my dad has psoriasis, so I get it.
All of these changes can impact the structural integrity of your nails, which can lead to chronic discomfort. Unfortunately, there's no cure for psoriasis, but there are treatments available. Your dermatologist may prescribe corticosteroids or a vitamin A derivative, and in some cases, injectable biologic psoriasis medications, which are formulated to block the immune system from developing skin cells too fast, may be prescribed.
Did anyone notice George's fingernails?
Oh my, yes. They look like they were eaten away by weevils.
From an aesthetic perspective, symptoms of psoriasis can be difficult to hide. If you're self-conscious about the appearance of your nails, it's usually safe to apply nail polish to conceal the imperfections. Just avoid using fake nails, as everything from the glue used to affix them to the application and removal method can aggravate the nail, leading to more damage. An underactive thyroid can cause structural changes to the nail. Hypothyroidism develops when the thyroid gland doesn't make enough of the hormones responsible for cell growth. Dermatologist Dr. Hannah Kopelman, MD, explains to Yahoo Life, the thyroid gland produces hormones that are crucial for regulating our metabolism, which affects how quickly cells grow and repair. When the thyroid isn't working properly, it disrupts this balance, leading to issues with the nails. Specifically, people with hypothyroidism may develop vasoconstriction, which causes the blood vessels to thin. Because blood volume to the nail nails is reduced, it can affect the condition of the nails. According to dermatologist Natalie Hone, MD, this results in thick, slow-growing nails that are brittle, with noticeable vertical ridges. It can also cause the nails to crumble and break easily, or cause the fingertips to look puffy. If your doctor diagnoses you with hypothyroidism, you'll usually be prescribed medication to replace the hormone. That can help minimize many of the symptoms associated with the condition, potentially strengthening your nails in the process. Practicing good nail hygiene can be helpful too. Keeping your nails short, for example, can prevent breakage and further weakening of their structure. Like psoriasis, rheumatoid arthritis is an autoimmune condition that causes inflammation to flare throughout the body. While that inflammation typically impacts the joints and makes movement difficult, it can also affect the nails, though experts aren't entirely sure why that is. While the ridges aren't serious, some people may find them aesthetically displeasing. Dermatologist Dr. Curran Lal tells Health Central, there are no specific topical treatments for RA-related nail issues.
You keeping your fingernails clean?
Never leave home without my rubber gloves.
He recommends practicing focused nail care by keeping them short, ensuring they're clean, and limiting exposure to harmful agents. Doctors suggest that treatments should ideally focus on reducing inflammation, as the condition is systemic and the nail symptoms are an effect of that. If your body lacks the sufficient building blocks required to make keratin, nail growth and structure can be affected. This can lead to issues like peeling and ridges. This is primarily due to prioritization in the body. When your protein intake isn't sufficient, your body needs to decide where to direct its energy. It will always put functions like supporting organs and repairing muscles over nail production. These visual symptoms can tip you off that something might be amiss, especially if the ridges become more pronounced over time. You may also notice changes to the look and feel of your hair and skin, both of which are supported by keratin. If you suspect you may have a nutritional deficiency, you can try increasing your protein intake. Helpful foods to consider include eggs, salmon, broccoli, carrots, and sweet potatoes. People with chronic kidney disease may notice their nails subtly change as the disease progresses. Typical signs are horizontal lines or a distinct separation between the pink and white parts of the nail. While not everyone with kidney issues experiences nail changes, it can be a clue that there's something deeper going on. When the kidneys are no longer working properly, it affects their ability to efficiently process nutrients, toxins, and proteins. That can cause waste to accumulate in the bloodstream, making it harder for the body to absorb the vital nutrients it needs to thrive and to keep things like your nails healthy. Over time, that can weaken the nails, slow growth, and cause those telltale ridges to form. Unfortunately, there aren't many direct treatments for nail changes related to kidney disease. The most important step is to address the underlying issue. For kidney patients, that means dietary management, in particular, managing and potentially eliminating altogether intake of sodium, phosphorus, and protein. Chemotherapy saves lives, but it can come with a host of side effects, including changes to the nails. Chemo drugs target and destroy certain cells, including those located in the nail matrix. When these cells are killed off, the nails may come in more slowly or develop visible imperfections, such as horizontal ridges. The American Cancer Society recommends that patients who experience ridges resulting from chemotherapy apply protective nail polish. This might be a water-soluble formula that creates a barrier to prevent further damage, or it may be a prescription product, depending on the severity of the ridges. If the nails are splitting and brittle as well, the latter may be a more suitable choice. For many, these side effects are temporary and should resolve following treatment. That said, it can be frustrating to deal with a dramatic change to the nails. According to the University of Texas MD Anderson Cancer Center, it's best not to get nail treatments like manicures during chemo. Instead, keep nails trimmed short and moisturize using mild, fragrance-free lotion. While we mostly associate stress with mental health, it can also have a significant effect on the nails over time. Your nails require several key nutrients, vitamins, and minerals to stay resilient and maintain their structure. Because stress affects the body's ability to absorb many of those, including protein and iron, you may eventually experience a change to your nails.
The days went on like this. I ate my own fingernails.
Not only that, if you're stressed, you may also develop bad habits like biting your nails or tapping them excessively. While these things may seem relatively harmless, over time, they can have an effect on the nails' structure. Dermatologist Dr. Curran Lal tells Prevention that biting is actually traumatizing to the nail, and dermatologist Dr. Noelani Gonzalez adds, by not picking at your nails or the skin around them, you're decreasing the chances of causing nail irregularities. Practicing mindfulness, exercising, finding an outlet for your frustration, and limiting exposure to social media and news can all be beneficial tactics to ease your stress and help you avoid coping mechanisms like nail biting.
Your fingernails are strong and healthy. I mean, hey, whatever you're doing, keep it up, sister.
It can be frustrating to visit the doctor's office with a specific concern only to be told that there's nothing medically wrong. On the one hand, that can be an enormous relief. On the other hand, you're still dealing with mysterious ridges on your nails. Luckily, there are a few solutions you can try that may be helpful. Among them is one of the most simple. Give your nails the VIP treatment. Moisturize your cuticles and don't bite them. A nail hardener may also help, especially if the issue is related to weakened or splitting nails. In this case, your dermatologist might recommend a nail strengthening agent that creates a protective barrier and fills in the grooves in your nails. If you're shopping around for an over-the-counter formula, read the ingredients closely. Speaking with prevention, Dr. Amanda Zubek says, in-store hardeners typically contain formaldehyde, which can temporarily harden nails in the short term, but ongoing use can actually cause the nails to become more brittle and weak. Watch your diet too. Even if your doctor determines there's no medical cause for the ridges, you can still help the situation by eating a vitamin and mineral-rich diet filled with a rainbow of fruits and vegetables. Dermatologist Dr. Saya Obayan tells Good Housekeeping, nail health starts from our insides.